Hey everyone, my name's Ryan and I am, as of today, a third year medical student because in just a few hours I will start my first clinical rotation. And so I'm coming on because I want to talk to you all about what medical school is actually like. This big stack right here is a representation of what your first 2 years are like, or preclinicals, which I just finished. And literally everything that you do is basically study. So these are most of the resources that I use. I mean, pretty much they're all of them, as well as all the stuff that I used on the computer, which is not shown, but here's some flashcards, here's this. And a week and a half ago, I just took a test that basically went over every single thing that we learned, called Step 1, which I'll talk about later. So medical school all starts out with the white coat ceremony. And that was such a magical and incredible day because you basically have no exposure to anything, but you get to walk up on a big stage in front of a big crowd of people and you get to put on your white coat for the first time. And it's such a really cool experience. A lot of the parents and people there are super proud and cheering, and I don't know, it was an emotional day, I guess, because it was very special. So it's like you kind of put on this white coat, and to me it kind of felt like I was playing dress up because I didn't know anything about, medicine yet. And it felt like I was almost like an imposter. I was like, well, this is it was amazing, it was awesome, but I was like, what is this? So yeah, after your white coat ceremony, you dive right into school. And your first 2 years, you really don't interact very much with patients. We were assigned a random doctor called a preceptor that we would visit once a month, and we'd have to get a signature from the doctor that we went, and we'd go and do different tests and stuff, things that we learned. But very minimal patient interaction. And that's because your first 2 years are all about learning about the human body, learning about what goes wrong, and then how to fix it with therapy, medicine, or surgery, etc. And so that's basically what I've been doing these last few years, and that's pretty much everything right here that you see. And every semester is different. So most medical schools, you'll start off with anatomy as well as biochemistry and a lot of the stuff that you learn in undergrad, but at a much faster pace, as well as other classes. Every school is different, but that's how it was for us. And anatomy, pretty much everyone starts with, is an incredible experience. It's where there are 4 people assigned to one, what they call tank, and it's this big metal box, and inside it is someone who donates their body to science, called a cadaver. And it is an absolutely incredible experience. What you do is you learn anatomy, in class, in your book, and then you dissect throughout the entire body. So from the head, we cut off the skull, we pulled out the brain, saw the arms, legs, and basically what our tests were on was being able to identify different structures. So we'd have all these different tables, of different cadavers, and there would be a little pin on random parts where we'd have to write down what it was. And so it's really good that we started off with that because it really kind of laid the framework for everything that we have to learn afterwards, all the different organ systems. And I will be honest, it was very difficult because we took classes and anatomy, so it was we were going to class 8 hours a day, and then we had to still study a lot. And they say for every hour of class, you want to spend 2 hours studying. So it definitely felt overwhelming at first because it was a big adjustment, but again, very rewarding experience. And so, every week for our classes, we'd have quizzes that kept us accountable for what we had to learn. We had a lot of group work. So I had 3 different groups, and basically, in each one, we would take a quiz every week. And then afterwards, we'd all sit together and we'd take a quiz. So there would be, I think, 6 of us. And we had these little scratch-off tickets. And it'd be 1, A, B, C, and D. And we'd have to scratch off to see if the answer was right. So you scratch it off. And then if there was a little star underneath, if that was the answer, then yay, you got the question right. And the reason why they do that is because they wanted us to work together and get used to collaborating with other medical students and future doctors. So that was pretty cool. It was neat. And another class that's pretty big is called Clinical Skills. And basically, we got thrown into that right away. And every single system has a different test. So when you go to the doctor, they they'll listen to your heart, and they'll you know, like sometimes like to check your hearing and stuff like that, and like put little like things that ring on top of your head. And that was what we learned our first semester. So we learned every single test for neuro, for cardiology, for oh gosh, you know, every system, like listening to the lungs. And so we laid the groundwork, and then after that first semester we started actually seeing like patients. So they're called standardized patients because people voluntarily get paid to come in to these little tiny fake doctor's offices where there's like little cameras watching us, and we're being recorded, and we'll go in and like do the different tests and get graded. So we do a lot of practice, and then on the real like test, which they call an OSCE, that's when the cameras come on and that's when we get graded. So like our first semester, we were tested on being able to go into a room and do whatever test that was on the door. So I'd have 8 minutes to do an entire neuro exam. So I'd have to do all these tests that could check all the different nerves and be able to do it in a certain amount of time, because that's, you know, what we have to do in the real world technically. And after that, we started getting tested on like clinical scenarios, like being a real doctor. We started doing tests that actually corresponded to different diseases. Like we'd flip this thing up on the door outside the little fake doctor's office, and we'd read like a scenario, and then we'd have to go in and actually perform tests that we thought were important to do based on what scenario was stated and based on the conversation that you had with the patient. So they really prepped us to become doctors, which, you know, that's what you'd expect from medical school. And it was kind of hard at first getting used to, but over time it got better and better, and it was really cool kind of like learning to become a detective. We also would do the same thing with like groups of students, so we'd all go in and like hear cases and talk about it together. They really were great about getting us to collaborate with other students. And so after the first semester, besides clinical skills, it was kind of a new start. We didn't have the same amount of hours put in because anatomy, which we took in the afternoon, was gone. But we dove into a little bit of harder subjects, which is the organ systems. And basically, we took one class at a time. And that's how most schools do it, is we spend the first 2 weeks in something called hematology and oncology, which is cancer and the blood. And then the next modules, we call it, it's like a class. We spent 4 weeks studying pulmonology, which is the lungs. So it's kind of like you focus in on one class at a time, which is really helpful because it kind of helps you really become an expert in that field all at once. Your first 2 years all prep you up for one test called the USMLE Step 1. I have the book right here, the study guide. And it is a high stakes test because it can really determine a lot of your future, what kind of doctor you can become, as well as where you can go, like if a city is very competitive or an area or program. You know, to be like a neurosurgeon or a dermatologist or a orthopedic surgeon, you have to do really, really well on the test. And so basically how you score kind of determines how many like doors are open for you and how many options you have. You know, it's different because you're competing against such a bright and intelligent group of people. So it was definitely a nerve-wracking process for me. I just finished a week and a half ago, and I won't get my score back for another probably 2 to 3 weeks. So I'm waiting on that, and that will kind of like, you know, determine where I can go and stuff. But at the end of the day, I am very proud because I know I passed. I know that happened. And I think at this point, that part of my life is over. Every school just gives you a completely blank canvas schedule. Honestly, I liked not being on a schedule at all studying for this exam because I got to wake up when I wanted, do whatever I want, and obviously I studied all the time because it was important to me. But there was a lot of freedom in what I got to do. I didn't have to dress up and go to class and do all these other things. And it was also a really good opportunity to relearn everything that we learned, because as of today, I'm going to need to apply a lot of this knowledge into the real world, like knowing the drugs and all of the types of cancers and things that go wrong, like I was saying. So if you guys like this video, please give it a thumbs up. And if you want to keep up with the videos that I'll start posting every 1 to 2 weeks, please feel free to hit the subscribe button and follow me on Instagram too if you'd like. And yeah, I really want to start being able to vlog as well as talk about things going on in healthcare news and the news in general, as well as do these kind of talks where I pour out my feelings and my experiences to help you guys. And if you have any questions, you can comment them down below, as well as DM me on my Instagram. And I want to close off by saying, if you like being in the medical field, if you love it, like you volunteer and you go out and it's something that you enjoy, go for it, because it's not going to be that miserable if it's something that you actually like doing. And that's been the most exciting part for me, is that I get to wake up and do something that I love. And that's why I'm excited today, because I'm going to start my clinical rotations where I actually apply all of this to the real world, and I get to interact with patients and take histories and help work with residents and doctors. So I'm really excited, and I'm going to start filming that kind of stuff. So thanks for listening. Hope you all have a great day.